we're recording. Hi.
Hello.
Thank you for coming and being my volunteer for this interview.
Absolutely.
Before we start, I want to go over an informed consent with you, and then I'll have you sign it if you agree to everything in it. But it basically just says that the content of this interview will be recorded, and that anything that you tell me will be kept confidential between you, myself, and my professor. Unless you mention any information regarding suspected or planned abuse towards the elderly or children, and that I am a student and am unable to formally diagnose, treat, or make any type of recommendations.
Perfect.
And so here is that informed consent. You can scroll down and sign if you agree to everything. There you go, so we can read it there.
Perfect.
And then it's there, so you just scroll up and down and then press that button when you're ready to sign.
There we go.
Thank you
That's the
very
coolest
much.
thing.
No, I love this. Makes life a little easier.
Let's do this.
Okay. Alright, so we're going to start with a little background information and then we'll get into the rest of the intake. We're going to start with your full name.
My full name is Kelly Ann Guthrie.
A-N-N, A-N-N-E.
A-N-N.
G-U-T-H-R-I-E.
Yes.
Perfect. And your date of birth?
12/29/1998.
Perfect. Alright, so tell me why you're here today.
So I've been having some anxiety symptoms, I would say, and I'm going through a lot of changes right now. Just moved home from school from college, and I'm kind of adjusting to the adulthood, but also living at home.
Yeah, that can be a really difficult transition. Tell me a little bit about that transition so far.
So it's hard because I live at home with my parents now, and I felt like I gained a lot of the autonomy in college where I could do my own things, and now it's like, I'm like, hey, I'm leaving the house, and they're like, where are you going? When are you going to be back? So I kind of feel like I took a step back in my independence, but then on the other hand, I'm working a full-time job and gaining that type of real-world experience of adulthood, but not really having the social part of it with living at home.
Yeah, that can be really difficult, especially when you have, like you said, all that independence and freedom at school and coming back home and having almost this struggle with your role. Are you
Yes.
a child again, or are you functioning as an adult within the family unit?
Yes, I would definitely say that's like a great way to put it.
How's your work?
Work is pretty good. I like it. I'm adjusting to, waking up early and being there all day because of classes. It was like, oh, like I can schedule my class at 11 and it's only until 12:30, and then I can come back, take a nap, and so that's kind of hard for me, is getting adjusted to that. But as the work, I really enjoy it, and it's along exactly what I want to do, like working with people.
What do you do?
I am a registered behavioral technician, so I work with kids with autism, and I work for a children's hospital that has like a branch for their autism center.
Well, that sounds exciting. Do you
Yes.
enjoy working with your kids?
I do. I really do love the kids. At first, I was I didn't really know what the job was or what my role was, and then I got into it, and it was along the human development role that I really like, and working with that age group.
So you mentioned that you were experiencing some anxiety.
Yes.
Do you want to tell me a little bit about that?
Yes. So I got diagnosed with anxiety whenever I was, I'm going to say 17 years old, and I've been on an SSRI since then. And I kind of goes in waves, and I would definitely relate it to like my, like with my life, like if everything's going great, like my anxiety's not bad, and then whatever barriers are within my environment, that's kind of when it strikes. And so I think just starting work and being at home kind of spiked it up, and I'm just having a harder time coping with it.
Oh, I'm so sorry. What are some of the symptoms that you have when you're experiencing anxiety?
I would say my heart starts racing, a lot of invasive thoughts. Sometimes I get like a red rash on my chest, and I just kind of, I would probably say like the invasive like thoughts are like the worst, where I just think things are much worse than they are, and then I look back on it in the future and I'm like, oh, it really wasn't that bad. Like, why did I think it was that bad?
Yeah, sometimes anxiety can kind of take over the body.
Yes.
can't it?
Yeah, definitely some physical symptoms of it.
What are your coping mechanisms?
So my coping mechanisms, to like preventative ones, I would say practicing mindfulness and gratuity. And then during them, I try to practice on my breathing. And then I use this one technique that I learned where it's describe 5 things that you see, 4 things that you can hear, kind of those. But it's just hard, like sometimes when I'm in the middle of my anxiety, I kind of forget those, and I just let the anxiety kind of take over.
Naming things that you see, smell, taste, feel. Those are some really great grounding techniques.
Great, okay, yes, I've been trying to use those.
And how does that go when you use them? Does that help at all? Does that make it worse?
I would definitely say that it helps me and kind of brings me out of my head and more so into the situation where I can handle it rather than just continuing to think about it.
Are there ever times when your current coping skills are not helpful?
I would say there are some times, and I think it's more of like a mental block where it's me saying that this isn't going to help, so it's like I'm not really trying to use them. So I think a lot of it would be probably like putting trust into like the coping skill that I'm trying to use, and actually try to get out of the anxiety rather than dwelling in it and kind of acknowledge, like in just saying that it's like part of my everyday life.
Right.
Yes.
And how often would you say you have these anxiety attacks?
I would say probably about maybe like 4 times a week.
Do they ever happen at work?
Yes.
What triggers them at work?
Probably one of my clients. I feel like going into this role, it's kind of unlearning a lot of things about normal human behavior, as I would usually do with kids that I'm babysitting. And so it's kind of like a lot of ignoring like aggressive behavior or behaviors that aren't, I would probably say, like socially acceptable. And so I have to learn that these are normal behaviors for children with autism instead of thinking what is socially acceptable. So it's kind of not being triggered by the non-compliance and different array of behaviors.
Right, a lot of times kids with autism and other cognitive disabilities don't have the language, right, to describe how they're feeling. So sometimes lashing out in ways that we don't see as socially appropriate is totally appropriate for these kids.
Yes. Yeah, that's what I had to learn, and that was hard to learn that, and then hard to figure out what they're trying to say, what their needs are, if their needs are being met, and if what they want is being met.
Well, I'm sure that sounds like a lot.
Yes.
Sounds like it can be very stressful.
Yes. It is pretty stressful in those situations.
Do you ever have situations where you're working with this client and you're having an anxiety attack and you're not able to get yourself out of it and you have to like step away for a moment or anything like that?
Yeah, we have a really great system where we can call for breaks or call for guidance, and I learned that with myself sometimes it's best that I call for somebody to help guide me through something rather than taking a break, because I feel like my anxiety can be helped by preparing for the situation, like knowing that I'm preparing for it the next time rather than escaping what's triggering me.
Yeah. I'm glad that you have that support system in place at work.
Yes, it definitely is a strength about my work.
Is there anything else you want to add to the to this part of the interview?
No, I think that covers that pretty
Okay.
well.
All right, well, we're going to continue on a little bit. Have you ever received counseling services before?
Yes, I have. I received them whenever I was in high school, so that was probably, I'm going to say 2016 to 2017, so about a year.
Do you remember who the counselor was or who they worked for?
Yes, it was Nicole Lee, and I forgot the name of her practice, but she's private practice and it's just her.
Have you received any other type of therapies or services outside of counseling?
I have not.
Okay. We're going to move on to discussing family history, social history, kind of like your support system.
Awesome.
Let's start with your family history.
So I have my mother and my father who I live with, and then I have two older brothers, aged 25 and 28.
You mentioned you lived with your parents.
Yes.
Is it just the three of you, or do one of your brothers live with you?
It is just the three of us. My brothers moved out about a year ago.
What do your parents do?
My mom is a front office receptionist, and then my dad works in insurance. He sells commercial insurance.
Do you have any pets?
I do. I have two dogs named Kitty and Nancy, and they are two failed guide dogs.
Well, that's really interesting.
Yes, I raised them at the University of Georgia as like a community service, and I had each of them from like a year and a half to 2 years training them to be guide dogs and they got sent up to New York, but both of them ended up failing for just their personalities, pretty much.
And you got to keep them?
Yes.
Well, that's exciting.
Yes. Yeah, it was saving grace just because I think being around my dogs is also a coping skill that I use in their therapeutic benefits of them.
Do you utilize either one of them as a service animal or an emotional support animal?
I do not.
Do you have any other pets in the home or just the 2 dogs?
My parents, they have 2 dogs. They're all labs. They all get along really well. Thankfully, my parents adore my dogs too, so we just have a big pack of dogs that just honestly run our house.
That's sweet.
Yes, we're definitely like dog people. Like all of us, like we'd rather not go on vacation because we'll be happier at home with the dogs on a weekend.
So how's your social life moving back home from school?
My social life, so it's so hard going from being in college and surrounded by all my friends, all my roommates, and then moving back home where none of my college friends who I spent 4 years with live in the same area. So I'm struggling with that and, trying to find time to hang out with them with work. So that's something that I've been struggling with that I would say is also causing me a little bit of anxiety as well. But I would say that I have a really good best friend who lives about 35 minutes away from me who I can rely on.
And you get to speak with her often?
Yes, we text, I would say, every day. We can always just like pop in and say like, oh, listen to this, look at this video. It doesn't really have to be like, hello, how are you today? Like it's very casual.
Sometimes it's nice to have those simple, casual conversations with people.
Yes, it's nice just to like share a funny video and like knowing that like they can also laugh with you during that. So like over a phone rather than having to be in person.
And that's great that y'all are able to maintain your relationship while living a little further apart than you're used to.
Yes, yeah, I definitely have maintained most with her out of like all my other friends from college.
Do you ever go out?
I do. I have been, my one friend, Lizzie, she doesn't really go out. She's the one who lives close to me, but I do, like, we'll text my brothers and be like, hey, what are you guys doing? And then I'll drive up to Atlanta and can stay with them. Just trying to go out and hanging out with their friends or just, like, staying at their place with, like, their friends, or my oldest brother has a girlfriend, so just to build up that social aspect rather than staying at home.
It's a nice little change of scenery too.
Yes, yeah, it definitely is.
And I
Makes
guess
you feel
another
doing
way for you
something.
to get some independence.
Yes, yeah, I've been trying to, and thankfully I can really close with them, so they know that I'm kind of struggling with the independence thing because they went through it too, so they're like, come on down.
What kind of support systems do you have in place?
I would say that I have like a pretty good support system. I can rely on my parents really well. I mean, it's hard to talk to them about my anxiety with living with them because I feel like it's kind of hard to tell them that I'm struggling with it whenever, they do want the best for me. I'm close with my brothers and I'm close with my best friend, so I feel like I have pretty good ones. Work is a great social or support system as well.
Do you have any current or previous legal issues?
I do not.
You mentioned you graduated college recently.
Yes, I did.
Where did you go to school?
I went to UGA.
What's your degree in?
It is in human development and family science, and then I have minors in human services and social work.
What year did you graduate?
In 2021.
And you mentioned you were still in school?
Yes, I am in a master's program online.
What's the program?
The program is in mental health counseling and rehabilitation counseling at a school in Thomasville, Georgia.
Do you have an expected graduation date?
It is not, so this is fall 2022, so it would be, my last semester would be fall 2023.
Well, it sounds like you're almost done.
Yes, yeah, about a year and a half.
That's exciting.
Yes, I'm very excited about it.
We're going to move on to occupation.
Awesome.
And where do you work?
So I work at Children's Healthcare of Atlanta in their autism center.
What do you do at their autism center?
I'm a registered behavioral technician.
Registered behavioral technician. And what does a registered behavior technician do?
So we pretty much so for 3 hours in the morning and 3 hours in the afternoon, I have a client and we just kind of work on their, I would say their language acquisition and kind of just looking at their behaviors, and we're pretty much just collecting data on their language, on their behaviors for the BCBAs to analyze and implement interventions.
How long have you worked here?
I have worked here for almost a year. It's about, yeah, almost.
Do you enjoy your job?
I do.
Are you experiencing any financial troubles?
I think just the post-grad, trying to learn how to handle my money, but I still live at home, so I don't really have the burden of independent living. So I would say not yet.
Alright, we're gonna move on to your current medical conditions. Do you have any, or have you been diagnosed with any medical conditions in your lifetime?
Yes, I was diagnosed with anxiety in 2016, and then I was prescribed Lexapro, which didn't work, and then I've been on Zoloft since 2016.
And who prescribed the Zoloft to you?
It was Emily Downs at Mara Family Medicine.
Is she a doctor or an NP?
PA.
PA?
Yes.
I missed one.
Come on.
Do you have any other medical conditions?
No.
Are you pregnant?
No.
Who is your primary care physician?
Emily Downs. The PA.
When was your last physical exam?
It was December 2021.
You mentioned you were on Zoloft.
Yes.
How much Zoloft are you on?
50 milligrams.
50 or 15?
50.
50. Once daily?
Yes.
Do you experience any side effects?
No.
Are you on any other medications?
Yes, I am on Xanax as needed, and that's 0.25 milligrams.
Also prescribed by Emily
Yes.
Downs? Any side effects with the Xanax?
No. Or I guess it makes me sleepy.
Do you have any medication allergies?
No.
Do you feel like you're safe at home?
Yes.
Do you feel as if you're threatened in any way?
No.
Have you ever experienced any type of abuse?
No.
We're going to move on to the suicide and homicide evaluation portion of the assessment. On a scale of 1 to 4, with 1 being none, 2 being slight, 3 being moderate, and 4 being extreme or immediate, how would you rate yourself for risk of suicide?
1.
How would you rate yourself for becoming violent?
1.
How would you rate yourself for the risk of committing homicide?
1.
Have you had any previous attempts or episodes for suicide, becoming violent, or homicide?
No.
How would you describe your sleep?
I sleep pretty good, but I have a hard time falling asleep. I feel like my mind is racing.
Once you're asleep, are you able to stay asleep, or do you find yourself waking up from time to time in the middle of the night?
I wake up time to time.
And how would you describe your appetite?
It is normal.
Have you experienced any recent weight gain or weight loss?
No.
we're going to move on to the substance use portion of the intake. I'm just going to go through a list of different types of substances, and we're going to go over amount, how things are taken, duration, frequency, that sort of thing.
Okay.
Do you use tobacco?
No.
Do you drink alcohol?
Yes.
How much alcohol do you drink in one sitting?
Probably, I want to say 1 to 2 servings.
What kind of alcohol do you drink?
Usually seltzers or wine.
How long do you drink?
Probably, I would say for like 1 to 3 hours.
Okay, and how often do you drink?
Probably twice a month.
And when was the last time you had a drink?
It was 2 weekends ago.
Do you use any illicit drugs?
No.
Do you use any prescription drugs that are not prescribed to you?
No.
Do you use any over-the-counter medications?
No.
Do you use any other type of drug or substance that I have not mentioned yet?
No.
Alright, so this is just gonna kind of be a yes or no. I'm gonna go through a list of different symptoms, and I just need a yes, I experience them, or no, I do not. Withdrawals,
No.
blackouts,
No.
hallucinations,
No.
vomiting,
No.
severe depression,
No.
shaking,
No.
seizures.
No.
Awesome. We're going to go over your patterns of use for alcohol. The next few questions are just going to, again, just be a yes or no answer. Do you drink more alcohol under stress?
No.
Do you continue to use when others have stopped?
No.
Have you ever lied about the consumption of alcohol?
No.
Have you ever tried to avoid others while drinking alcohol?
No.
Have you ever been drunk for several days at a time?
No.
Do you neglect your obligations when you are drinking?
No.
Do you drink more than you intend to?
No.
Do you need to drink more to become intoxicated?
No.
Have you ever tried to hide your consumption of alcohol?
No.
Do you ever drink before noon?
No.
Are you unable to limit the amount of alcohol you drink once you have started drinking?
No.
Have you been unable to keep promises to reduce the consumption of alcohol?
No.
Are you involved in Alcoholics Anonymous?
No.
The next one can be a yes or no, but also a little bit of a short answer. Have you ever tried to stop drinking alcohol?
No.
All right, we're going to move on. What are your goals for therapy?
I would say I want to gain more coping skills and putting more trust into them in myself to overcome my anxiety attacks.
Is there anything else you wish to discuss that we haven't talked about so far?
No, I think we covered it all.
Okay, perfect. Well, then this concludes our intake interview.
Yay!
Thank you so much for doing this for me. I really appreciate it.
Yes, absolutely.
Awesome.